My name is Christine Schoppe, and I am the Chief Strategy and Growth Officer at Points of Light. And on behalf of Points of Light and Crisis Text Line, it is really my pleasure to welcome you to our conversation today. Whoever is listening, we're glad you're here with us. While many are ready to claim the end of the global pandemic, I think we know the fractured systems, the unmistakable inequities, the vulnerabilities and fragility that has really been kind of exposed and exacerbated within communities and within people really will be with us for some time. And specifically, the pandemic has really challenged the mental health and well-being of millions. I don't think anyone has been untouched by the experience that we've all been through in the past couple of years. The good news is that more and more people are talking about mental health in our families, our friends, our workplaces, the content we stream, the podcasts we're listening to. So it's wonderful, but we really are still far from a world where mental health is fully valued, it's promoted, it's resourced. And of course, conversations can still feel complicated or even uncomfortable. So, we're really excited to have this conversation today. I think that with, the global mental health crisis, with compounding crises across a bunch of social issues, what we're excited today to talk about is really, this is a unique time to talk about the intersection of mental health and civic engagement and how they can support each other and how they're critical for each other, how they intertwine, how they're both necessary for a thriving and healthy society and a healthy people. And so to that end, I'm really thrilled to be joined in conversation today by one of the leaders in the crisis care system, Becka, the Chief Program Officer at Crisis Text Line. Just to make sure that you have the appreciation I do for having Becka here today. She's a licensed clinical social worker with over 15 years experience in mental health, with experience in both direct practice and mental health leadership, as a psychotherapist, managing a residential program for young men transitioning to adulthood, providing teletherapy in a medical setting. In her current role at Crisis Text Line, Becka oversees the clinical team to ensure quality crisis intervention service through tech. So we're so excited to have you, Becka. Thank you so much for joining.
Thank you so much for having me. I'm so excited for this very important topic today.
I am too. And would you start just by letting us know more about the mission and the work of Crisis Text Line?
Yeah, absolutely. So at Crisis Text Line, we're really guided by empathy and innovation, with the goal of promoting mental well-being for people wherever they are. So we provide 24/7 high quality text-based mental health intervention at scale by empowering a community of trained, empathetic volunteers that support people in crisis. And since our launch in 2013, we've supported over 7.5 million conversations. The bottom line is we're here and committed to creating an empathetic world where no one feels alone.
I love that. And I'll say we actually have several employees at Points of Light who have volunteered through Crisis Text Line. So it's an incredible organization, volunteer driven, and with the expertise of people like yourself. So thank you so much for being here and for giving us that explanation of your mission and then the great work and impact that you've already had since 2013.
Yeah, thanks. Yeah, and thanks to the volunteers from Points of Light. I would love to know more about your mission as well and the role it plays in corporate social responsibility spaces.
Absolutely. So Points of Light's been around for 30 years, actually, and we're a presidential legacy organization. We actually were founded by President George H.W. Bush. And while that is a Republican president, we are a nonpartisan organization united really on his belief, and really I think all of our beliefs, that the most powerful force for change in the world is an individual, is a person who steps forward, has found their light, hence Points of Light, and really wants to make a positive change in this world. And really that belief that started then is still at the core of who we are today. And I think is more urgent and more critical than ever for people to find that light. Our mission is really threefold. Our mission is to inspire, equip, and mobilize people to take action that changes the world. And, it's kind of like when you think about all the issues that are facing this world, including mental health, including cancer, poverty, food insecurity. Sometimes it's just like, okay, your mission is about getting people to take action, but we know that people are the driving forces behind the change happening in those social issues and are actual critical component to that. And when we think about those three pillars, we speak to inspire, we know that 2 out of 3 people do not actually believe that they can make an impact in their community. And, same thing with equip, because 4 out of 10 people don't believe they know what they can do to be helpful. What are the actions I should take? And so we know it's absolutely critical to combat that apathy that kind of seeps in, to combat that, I hate to say this word, fatalism that sometimes seeps in, that there's nothing that I can do to be helpful. And so Points of Light really is about supporting the individual in their journey to realize their power. And I think that also connects it to mental health when you think about being powerless. And we believe that engagement and civic engagement and volunteerism is a path to power and really having control, and also just expression of empathy, which I know empathy is a big part of y'all's mantra as well. But it's really a privilege to work at Points of Light and to be a part of that.
Yeah. Wow. What a great mission and a great undertaking. That's phenomenal.
Absolutely. I would love to, I would love to dig into a little bit more about crisis text line, and really the intersection of mental health is really on two fronts that y'all are working at. First of all, it's the people reaching out for help and those who are actually volunteering. So would love to understand a little bit more about kind of those two fronts, like how you are doing the work itself of counseling, but then also how you are working with these volunteers who are stepping up as crisis counselors.
Yeah, that's yeah, we do have sort of the two different lenses that we look through with our volunteer powered crisis intervention, and
Mhm.
ensuring that we're doing the absolute best by the people who are coming to us in crisis. And so we've learned a lot over our time operating at Crisis Text Line on sort of using best practices in the field around crisis intervention, as well as some of our data. We're kind of at the forefront of this digital health sort of movement and supporting through text versus
Mhm.
phone or other modalities. And so really using our learnings to help collaborate with everyone in the field to lift all ships. And as I said earlier, we're really powered by our volunteer base, and what you said around the agents or the drivers of change, and that's really what our volunteers are for here at Crisis Text Line. They're really changing the mental health landscape,
Mhm.
reducing stigma, ensuring that people know that it's okay to reach out for help and get support. And our volunteers, we have a volunteer base of over 55,000 people who've gone through our training. And I've been at Crisis Text Line for about 7 years, and I am in constant amazement at this group of just incredibly humble and powerful individuals who volunteer their time. And our volunteers really come from all walks of life, and different experiences, different um, demographics, and they take our 30-hour training, and which is done self-paced and virtual, and they're trained to use skills like empathy and active listening to ensure that somebody in crisis gets the support that they deserve. And our volunteers are extremely dedicated to our mission, and so they sort of implement the training around crisis support, collaborative problem solving, safety planning, and being there for somebody when they need it. And our volunteer base is fully remote, so our volunteers volunteer out of their home.
I love how sometimes I feel like a volunteer activity like this could possibly feel daunting to someone, like, I'm not equipped. So first of all, I love to hear how much training and thought, but I love how you just described it. It's as simple as just like being there for somebody who needs it. I love it's just as simple as that. And I feel like that's something all of us can resonate with, and all of us could then make that connection. You know what? I could do that. And so I love to hear that.
Yeah, and that's really exactly what it's all about. There's our platform is not for sort of formal or traditional psychotherapy or any sort of ongoing relationship. It really is being there for somebody who feels like they have nowhere else to turn, and anybody can do that. There's no expectation of you know, changing somebody's lifetime of crisis or trauma in a 45-minute conversation, but just
Yeah.
being there for somebody when they feel like they have nowhere else to turn is incredibly powerful.
I love that. And you said that they come from just all walks of life and all demographics and all just experiences and lived experiences. I'd be curious, how just in terms of that volunteer base, how do they how do they find you? And then how do you keep them? For Points of Light, we always are curious about like volunteer retention and keeping people motivated. And
Mhm.
especially this is hard work,
Yeah.
and it can be draining work too. I'm sure when you're work connecting one on one and expressing that empathy. So I'd just be curious how you'll find them, how you retain them, and incentivize them to keep on this work. Apart from, of course, how meaningful the work is.
Yeah, yeah, that is it's a great question. And really our like I said, our volunteers are from all walks of life.
Mhm.
So we tend to see our volunteers in the Gen Z category right now.
Yes.
So between 18 and 24. And so and I think that sort of the relatability of being able to understand and communicate through text over voice and
Mhm.
having the flexibility. Our platform operates 24/7, so being able to support and in a way that fits the needs of our volunteers as well. And we do a lot of partnerships with organizations, corporate sort of corporate responsibility
Okay.
movements, and so a lot of our volunteers hear from us or hear about us from that way. And the biggest driver of our volunteer recruitment is word of mouth. So something that we take very seriously is the experience of our volunteers, because like you said, this can be
Mhm.
tough work. And so we have a whole dedicated team to our volunteers to ensure that their needs are being met, and that they're able to have the resources and tools to do their
Okay.
work. And so yeah, so we center our volunteers and their experience. And we also have this and as you can imagine, many of our volunteers come to us because they want to make an impact and make a difference in somebody's life. And we have, at the end of our conversations with texters in crisis, texters have an option to leave feedback for their crisis counselor. And
Oh,
it is some of the most beautiful messages that can be seen around, just people or texters giving feedback to the volunteers that this is the first person who's ever told them that they were strong or that they could do it or somebody cares about them. And so having those kind of real life impactful connections is pretty powerful for our community.
that's amazing.
Yeah.
And then I wanted to pick up on your thread around Gen Z. I think from our research, so Points Light does civic engagement research, but from our research, one of the things we do is dig into like what are the issue areas people care about. And so from a pick list of over like 20 potential causes, everything from mental health to poverty to gun rights to all sorts of things, 4 to 10 people indicated that mental health was a top cause area for them. However, like that is almost entirely driven by like Gen Z and millennials who are saying like that is their top area of interest. They're more likely to be Gen Z. They're more likely to be women actually who say that that's a top area of concern for them. So it's we even see that in our data. So not, and also I guess from the technology perspective of how y'all's model of operations is, it makes sense that Gen Z is very much engaged.
Yeah, yeah, exactly. I'd love to hear more about um, civic engagement and
Yeah,
volunteerism
for
at your
sure.
organization, and sort of any how you incentivize and retain volunteers as well.
Absolutely. And actually, like I'll just say Gen Z has changed the way over the last couple of years that Points of Light has thought about volunteerism and civic engagement. Kind of going back to that kind of founding story, for 30 years, predominantly where we were focused when we said we want to inspire, equip, and mobilize people to take action that changes the world, the action we were talking about was volunteerism. And that's wonderful. And it still is very much a focus for today, and still has so much value and influence today. But over really the last couple years when we were looking at like when people, first of all, people don't want the label. First, this generation does not want labels in general, but they actually don't want even the label of volunteer. Like they're doing good, they're taking action, they're making change, they're using their voice. And so really as we were looking at kind of our strategic planning over the last couple of years, for Points of Light, a significant shift is a shift not just from volunteerism, but to overall civic engagement. And that's really because we wanted to value all the ways that people can step up and make a difference in whatever cause area that that matters to them, or whatever community matters to them. And so we've kind of coined it into a framework. We call it the Civic Circle framework. And really it's a wonderful lens through which to think about your pathways to take action, and your pathways for civic engagement. It has 9 different elements, and I've already listed a couple, but in addition to volunteerism, we want to make sure people understand, like, hey, like, your purchase power, the way you think about your personal spending has power. The way you think about participating in the electoral process is not just showing up to vote, but how do you help people register? Have you thought about being a poll worker? Even the process of like doing your due diligence before you show up to the polls is an act of engagement. Like, I'll just say this: you and I are both in the social sector, but for people who are in corporate America, or more so in corporate America, the company you work for and the internal volunteerism you can do there, the employee resource groups you can join there to advocate for your, kind of special interest group, for lack of a better term. Like, you can use your place of employment to express your values and your beliefs. How we use our voice, everything from, there's the very visible marches, there's social media that's also very visible, but really where we're often influential is in those quiet conversations with friends and family, and how we can potentially change minds and hearts. And so Points of Light, really, when we think about civic engagement, is very passionate about making sure that it's inclusive, that it feels accessible, and that we're valuing the ways that people are just taking action today. And Gen Z really drove us to that. Actually, BIPOC communities really drove us to that realization. Volunteerism is wonderful, but can often be inaccessible in the way it has traditionally been defined over the decades. And so we're really focused on those pieces, and kind of just circling back to the word of like power. Like, we really call the Civic Circle as like your power to make change, your power to lead change in community. And again, when we think about just people who necessarily feel powerless in this world, you can look at the news and be like, what can I possibly do here? Like, we really do believe in the power of people, and we want to make sure people can see those pathways, see those access to engagement. And so that's really our kind of perspective on what civic engagement looks like today.
Yeah, wow, that's really impressive. That deep sort of intentional understanding and digging in. That's really incredible, and helps to shed light on the truth of there's not just one pathway that to kind of engage and take action and make change. So
And don't we live in the world of optionality? Like, we don't want to do it one way, like,
exactly.
and there's more than one way to do it and get it done. And also, like, how do we get it done in a combination of activities? We know that it's going to take all of us, pursuing passionately what we each individually can do and can contribute. So
Yeah,
absolutely.
exactly.
One of the things that I want to touch on is really talking about, I know we both have thoughts around the intersection between civic engagement and mental health. And I know one of the things that we often think about, especially is around, like, for those engaging in the social sector, for those of us working in the social sector, like, how do we take care of our mental health? I think about your crisis counselors, and it sounds like you have systems in place to make sure that they are taken care of. But I know, like, particularly in the pandemic, one of the conversations Points of Light's been having over recent years is like, when the world feels on fire, and we live in this sustained sense of response, and again, like, the issues that are coming at us around the world and in our communities, just, they feel like they come faster than they've ever come before. Like, I think we do know, like, our mental health can suffer. And so I know one of the things that Points of Light is really passionate about is like, how do we make sure that we create the space for people to feel like people who are working in this space, or maybe they don't work in this space, but they have considerable passion and interest, like, outside of their day jobs. Like, how do we make sure that they're maintaining the balance between, like, taking action, doing everything they can because they're passionate and they sense the urgency, but also recharging and, like, balancing for themselves. So I would just be curious to learn more about how y'all do that for your crisis counselors, and make sure that they're okay, and putting their oxygen masks on when they need to.
Yeah, exactly. And it's so important, especially for this group of highly motivated people who want to make change and want to see the world become a better place. Burning out quickly is not going to help anybody. And so we really come from a lens with our volunteers of a trauma-informed, vicarious resilience model of, it's sort of like a a fire drill that you do a fire drill before an actual fire, so you know where to go and what the route is before you're in a state of distress. And so even one of the very first things we talk to our volunteers about is creating a self-care plan, but that really highlights some deep reflection around understanding some, because vicarious trauma can come up differently for different people. So and so really guiding our volunteers through exploration and understanding of what their triggers might be. Like for somebody, it might be withdrawing from friends. For somebody else, it might be something else. And so
Yeah.
really an individualized sort of trigger so that the volunteer can have early indication. And then
Yes.
when that happens, what's something that they can do to and we do this for our staff too, and something that you could do to take care of yourself, because that's the most important. You can't take care of anybody else unless
Correct.
you are taking care of yourself. And so having a list of things when your brain is in a state of calm and not in fight mode, I think it's fight, flight, or freeze mode.
Yes.
And being able to have a clear head to say, here's a list of things that I know give me life, fill my bucket, and have those to lean on when you need them. We found that to be really helpful and effective. Additionally, there's times that there's no shame in taking a break, or saying like, my self-care right now is I need to step away for a couple of weeks, or
Absolutely.
however that looks.
It makes a lot of sense. And I think about, some points of lights volunteers and the people in the community. From our research, what we know is like predominantly a motivator for someone participating in a specific social cause or issue is like they've had personal experience with that issue. So I think about, to your point, like if the people that are caring about that issue, that are engaging in that issue, have been impacted by that, how are we making sure? I love that you have training around what are your triggers, like what is going to impact you in this situation, being aware of that, especially as I'm sure even in crisis text line, some of your volunteers have had significant crises themselves, and then therefore it makes them way more effective, but also like again having awareness for how I would respond in a certain situation. And we think about that too at points of light, in the sense of like people have had personal experiences with these issues, they're in communities, they've had lived experiences, and how are we encouraging them and giving them the space to take care of themselves? I think that's extremely important.
Yeah, that's fantastic that Points of Light prioritizes that mental well-being of your volunteers and participants. I'd love to hear more about that, of
Yeah,
how
and,
you
and
do
so
that.
actually one of the things I'll say is Points of Light specifically works through companies and then nonprofits for that direct volunteer, because one of our beliefs is like Points of Light, kind of our umbrella international organization. We're not the one, our kind of 60-person crew that sits at kind of headquarters, for lack of a better term. We're not the ones in community, and we're not the ones seeing the issues. And so predominantly what we're trying to do is equip actually our affiliates. We have 177 affiliates who are in 38 countries around the world. And then we also partner with hundreds of companies each year that they're activating their employees in community and making sure those are meaningful experiences. So we're really trying to do is through those institutions, making sure they have what they need to safely enter community in a way that's impactful and meaningful. And also like it's interesting. There's the potential for trauma whenever we enter a situation, but there's also like we want to make sure we're respectfully and not causing any harm to the communities that we're entering, which is why we do partner with like our affiliates who are on the ground and making sure they know the needs of those communities. And it's kind of like we don't want to harm anyone in the community, and we want to make sure that our volunteers are safe during the experience, but also afterwards, because the experiences you have can be draining. And we want to make sure that like no cause is getting solved if people are burnt out or had a bad experience. And so we are very focused on that with our partners.
Yeah. Oh, that's
Sure.
great. And I also acknowledge what you mentioned around not going into communities that you're not part of, and
Yes,
sort of telling people what they need instead of
absolutely.
listening. That's a very similar shared core value between our organizations of listening to people and listening to their needs without judgment, and offering that space and empathy.
Yeah, no, I think that I loved whenever I was reading more about crisis text line is that focus on empathy, and it's what Points of Light leads with. We know our volunteers lead with, and again, I think that's one of the other connections between like civic engagement and mental health is that we actually know, civic engagement and volunteering can actually be, well, it's one way. It's not the be all end all solution to improving mental health, but it is one way that mental health can like improve, and one of that is like an increase in empathy when you're having like those experiences and you get to practice empathy and be in someone else's shoes, take yourself outside of yourself, for lack of a better term. In addition to all the things, it's reducing stress, combating depression, the feelings of isolation that we all experienced during the pandemic. That's one of the things too, is like volunteerism had a dip during the pandemic, or volunteerism in traditional ways had a dip during the pandemic. And we actually now today see it as like a solution to that isolationism that we all felt. And like if we're all trying to re-engage with community and re-engage socially, we actually at Points of Light believe that civic engagement and volunteerism is a great first step to sort of like get reconnected after this period of disconnection. So
it's a really great point. There's a lot of research out there around the mental health benefits of volunteering and combating loneliness in particular during COVID. Being able to volunteer, connect with the community, feel like you're taking action, making an impact is hugely beneficial. We interestingly hear a lot. So I mentioned our 30-hour training that our volunteers take. And so obviously the intent of that training is to ensure that the texters are getting the best service that they deserve. And interestingly, we have found that volunteers are telling us that they are using that training in their personal lives too. And it's improving romantic relationships and work relationships, and being able to build the skill of empathy and understand the importance of validating somebody's perspective, and think that there's an impact in their own communities as well, is just incredible. Yeah,
I really love to hear that. And I'm just gonna, 2 weeks ago, there was a special report from Edelman, which is a big communications firm, that was about trust in the workplace. But I bring it up because one of their findings was like, how can the workplace be like a part of training people in like discourse, and like that we've lost some of that skill. So I think about what you like, so you're helping people actually have conversations, and that can be applicable to other aspects of their life. And I just think about this other report and I'm like, there's clearly something missing. We all need to be a little bit retrained. So it's something interesting.
Yeah, we at Crisis Text Line, all of our staff go through our training, and so we will lightheartedly joke around with each other during hard conversations. Like, we're going to go through the 5 stages of a conversation right now. It works, and it helps to see different perspectives and feel heard. And so, yeah.
Oh my gosh, you'd be like, I can tell I'm being walked through a framework right now, but it's working, so I'm gonna let you do it.
That's usually how it goes.
That's amazing. So one of the things I wanted to ask you about is that a part of my work at Points of Light and the Chief Strategy and Growth Officer is actually our research and insight. So we do a lot of civic engagement research, and I know Crisis Text Line has an immense body of research, and I was just curious about that body of research, why you do it, how it impacts the sector, and would love to hear more about that.
Yeah. So you're right. We have a huge sort of focus on research with the intent to share data-informed insights around mental health. And we share those insights with other nonprofits, with corporate partners, policymakers, media, and even the general public, to raise awareness around mental health issues and to ultimately impact positive change. So we do some collaboration with university research partners, and have really found that unsurprisingly, the interest in having conversations around mental health has really increased the last couple of years due to COVID. And so we are uniquely positioned to be able to add some insight to the conversations around mental health and potential impacts of federal policy or local policies, or any sort of insights that we've learned from what we do to help make informed decisions. And we also our data insights are open sourced and are available 24/7. The website's called crisistrends.org. And we distribute insights from that report to over 600 partners a month. So we try to keep the lines of communication open so that we can provide support and insight where it might be helpful to make an impact.
That's amazing. And I think what's interesting about that is one of the challenges on our side of the research is we're always asking people, like, do you intend to volunteer? Like, all kind of like intention. I think what's powerful about your data is it comes from like the experiences that are happening. And so it's real. It's not, there's always bias in surveys and bias in things that happen. So I think that's what's really powerful about your data is this is the trends that are happening and real conversations you're happening. I know privacy and all those items still adhere to what you're doing, but I think that's really powerful.
Yeah.
Very nice.
I'd love to hear more about the research that you see.
For sure. So Points of Light really for the last 3 years has been kind of stepping up in terms of its research, kind of original research production, and really what we're focused on is a couple things. Number one, we just want to understand like participation rates, like across the civic actions. And, I already went through kind of the concept of the civic circle. And one of the things we're really curious about is like, what are the engagement levels around those actions? How do they differ by kind of different, social determinants, the different demographics? And there are differences by generations. We basically we see Gen Z leading in 7 out of 10 of our civic actions that were. So it's always fascinating to see where leadership is happening and those items. We also are really just trying to understand the issues people care about and how those change over time. And again, it feels like it's often they're the issues that constantly just stay with education, the environment. They're always kind of like these non-urgent issues, except the pandemic made the education kind of a more urgent issue. But we always want to see those issues. But we have seen mental health rise in terms of the ranking, especially led by younger generations who say, I'm not only worried about my own mental health, my well-being, and my boundaries, and my self-care and all those things, but I actually care for this as an issue that my country needs to care about. And so really even our last research where we looked at the US, Brazil, India, and the UK, predominantly for that younger generation, they cared about mental health, and my country needs to care about this and their needs. So I think that's really powerful that it's not just I care about this, but my country needs to care about this. So leading the way there. So we care about like kind of issue trends, like, and I think what we're also interested in is like, what are the specific actions people are taking around those issues? So when we actually, dug into mental health and we're like, well, what are, people are saying they're taking action, like 4 to 10 people say they're taking action around mental health. What are they doing? And so honestly, it fell up in 3 things. So one is volunteering. So like, I think that's wonderful, but also people are taking the time, as I said, to listen and learn about the issue area, to be educated, to have a greater understanding, which I think is foundational and wonderful. And the other thing is people are using their voice. And we said conversations need to happen, more conversations need to happen. And so I think that awareness raising piece is extremely important. So we do care very much about like, what are the actions that are happening around specific issues? Like are people, people say we need to actually like vote on things like gun rights and gun violence, but we aren't necessarily seeing that translate into the actions. People say these actions have influence, but then are they actually doing those actions? There's a dichotomy there. And the other things we care about is what are the motivators and barriers to action? We know people are motivated, but for different reasons. I already mentioned that a top motivator is I personally have experienced that cause area or issue area and been specifically impacted, or someone I know has been impacted is the second one. So issue area, like motivations are highly personal, which helps us because as we're guiding nonprofit organizations to say, how do you convince people to join your cause? It's like, you have to make it personal. It's about them. It's about the people that they know, and that's who you're going to reach. for that, and then barriers, of course, like what is keeping people. We want civic engagement to be accessible, to be equitable. We want to understand what those barriers are and how we can remove those barriers. And so that's really what drives our research is those understanding those goals, and then creating insights and actions kind of with our ecosystem to improve upon those.
Yeah, that's great. Yeah, that's I'm sure there's some really rich information there too, deep understanding
Yeah.
as
Oh,
well.
absolutely. And I think one of the things that our research kind of dug into on the mental health piece, which is well, there's tons of research out there on this, but around like we always talk about the social determinants for physical health, but there's social determinants for mental health. And we talk about, whether it's like economic condition, my external environment, housing, poverty, access to healthy food. Like there's so many things that play into mental health. And one of our big messaging that came from our research has to be that, we have so many people who are engaged in the causes they care about. Like actually by engaging in those kinds of causes, you are supporting, mental health, because they are they are connected and they do have an impact and on each other. So that's another thing too from our research that we definitely pulled out.
Yeah, yeah,
Yeah.
that's interesting.
So as we wind down, one of the things, because I have you and the expertise is just like, what would you say for anyone who may be struggling with their mental health? What advice would you have, or how would you encourage them to get support?
Yeah, thanks for asking that important question. And I would say the single biggest factor here is if you are experiencing a mental health crisis or struggling with your mental well-being, you're not alone. There's people who are here to listen, to be supportive in whatever way you need in this moment. And so that can look different for different people. Sometimes it's maybe reconnecting with an old friend, or maybe used to be in therapy and then stopped going to therapy. So maybe might be time to re-engage if you're noticing that your functioning is changing. Additionally, talking for the first time, reaching out to a therapist or even a primary care physician to get some direction on where next steps. And then, of course, crisis text line is available 24/7 to anybody who is in a mental health crisis. Also, to clarify that our philosophy is that a crisis is determined by the person using our service. So sometimes that is a 7th grader with anxiety about a math test. Sometimes that's about a divorce. Sometimes it's about self-harm. Like the range is so broad. And if there is something that is impacting your mental well-being, that text us, and 24/7 available. And the number is 741-741. So it's right up the left side of the keypad.
Wonderful. All right. Thank you for that. And I feel so fortunate to have had this conversation with you. And I think we know there's so much more to be discussed around mental health and civic engagement, but it's just thrilled that there are professionals like you providing support and crisis care to others, and just grateful for this conversation today. Thank you so much.
Thank you so much. Incredibly appreciative for the opportunity.
Great. Thank you.
Thanks.